Hello and Assalamualaikum to Puan Aziza. Today, me and my partner Afi would like to present about travelling for One Health. But first, let me introduce myself. My name is Donna Shadaini binti Shahariza and my metric number is 17 UP21F1014. And now I will talk about the emergence of the new tourism in One Health tourism markets. Number one, the patterns of travel between sources and destination countries are well established. However, more accurate data are required about patient flow between different countries and continents. Next, whilst any global map of medical tourism destination, this estimate rely on industry sources which may be biased and inaccurate. Then, it will appear that geographical proximity is an important, but not a decisive, factor in shaping individual decisions to travel to specific destinations for treatment. And finally, the services may also volatile, with travel determined by both wider economic and external factors, as well as shifting consumer preferences and exchange rates. For some medical tourist destinations, attempts are being made to promote the cultural heritage and recreational opportunities. Next, I will talk about the changes in market demand. The demand is include the globalization economic, social and cultural technological. Many domestic health systems are undergoing significant challenge and strain. Unlike other forms of patient mobility where decisions on behalf of the patient are made by expert clinicians, health tourism involves individuals acting as a consumer and making their own decisions regarding their health needs, how this can be treated, and the most appropriate provider. Five drivers behind the increase of the health traveling is familiarity, cost, availability, quality, and bioethical legislation. Traveling for health also covers a multitude for types of demand, visits to health resort or health farm, activities holiday that designed to enhance physical fitness, seaside resort base, which is seawater treatment, therapy, and natural mud treatment or mineral water treatment. That's all from me. Thank you.
Alright, now I want to talk about tourist certification of the market. Okay, so as you can see in the slide, you can see four certification by tourists. The first one is tourist certificate with the service provide. Number two is the facilities they provide for tourists. Number three is the good service for customer or tourists. And the last one is the way the solve problem or disease faced by tourists. Alright, so the first one is service provide. So the tourists will be choose a best country or agency who make a treatment with a good service and near with their expectation. Okay, number two is the facilities they provide for tourists. Alright, so the facilities is very important to make a treatment or to make a traveling for health. Okay, and the tourists will be choose the agency or the country who have a good facilities or good system for treatment and healthy care. Alright, so the tourists will be trust with their treatment with the good facilities. Okay, number three is good service for customer or tourists. So the customer will be comfortable with the agency or country who have a good service for their patient. Alright, so the tourists will be more understand and easy to communicate and also easy to ask a question about their treatment or for their healthy life. Right, and the last one is the way they solve problem or disease faced by tourists. Okay, there are so many country have a treatment, but the tourists will be choose the country or agency also who have made a good solution for their disease or good solution for make a treatment for their healthcare. Right, so that's all about the tourist certification. We go to the next slide. Alright, now I want to talk about example of product in the market, which is the service they provide for tourists who want make a treatment or travelling for healthy. Okay, the first one is soft orthopedic issue, oncology and fertility issue. Number two is eye treatment for tourists. Number three is cancer treatment or health care Number 4 is the block work and general surgeries, and the last one is cheap plastic surgery. Okay, for people or for tourists who want make a treatment for orthopedic or have a problem with their body musculature, so they can go to United States of America, because of United States of America provide the treatment for orthopedic issue and oncology issue, and also fertility issue. Okay, number 2 is eye treatment for tourists. So tourists can get the eye treatment in Japan, okay, and they have a special offer for other people or other country come to Japan to make a eye treatment. Okay, number 3 is cancer treatment and healthcare. Okay, for people have a problem with their heart, and also they have a problem with their lungs, or want to make a treatment for their cancer. Okay, the tourists of the people can get this service in Kuala Lumpur, Malaysia. Okay, number 4 is block work and general surgeries. So for the people who want make a general surgeries, for example, surgeries for their organ, their body, or their legs or hand, so the people can go to the Canada. And the last one is cheap plastic surgery, for the people who want make a plastic surgery but in cheap price, so the people can go to Brazil for get a cheap plastic surgery. So that's all about example of product. Thank you very much. Alright, now I want to talk about the conclusion of this presentation, which is the conclusion for travelling for One Health is travelling for One Health, or better known as the travelling to get the best treatment, is very important in the tourism sector, because there are many advantages that can be obtained and can also help many tourists. Okay, for example, it can help tourists who like to save money, to invest money for treatment, or to get a quality healthcare, and it can also improve the economic sector to a country known for its good medical service and trust by tourists. Alright, so that's all about the conclusion, and that's all about the presentation. Thank you very much.